Good morning and welcome back to GP Video Podcast by Nadia. So today what's our topic? Our topic is, should you take cholesterol lowering medications? So if your cholesterol is high, should you be concerned about it? And should you be taking cholesterol lowering medications? And at what stage should you be taking cholesterol lowering medications? At what levels should you be taking cholesterol lowering medications? So people who know me and have been seeing my GP video podcasts from day one, they know that I'm a very pro medication person. And if there is any condition that is wrong, if there is any medical condition, I would rather go for medicating and finishing it or curing it or curbing it rather than waiting for too long. But of course, I'll go according to the guidelines. I would never jump the gun and just say that, okay, because I'm a very pro-medication person, so let's do it. I would go with the research, with the studies that would suggest that, yes, okay, there are harms, there are benefits, but the benefits outweigh the harms. Similarly is the case in cholesterol, high cholesterol. And why do we need cholesterol lowering medications when our cholesterol are that high? Okay. So 1 in 5 deaths in first world countries is from heart disease, which is inexcusable, given that there are so many ways to reduce our risk of getting heart disease. For some people, one of those ways is to consider doing cholesterol. So let's talk about the heart disease risk factors. Obesity is one of them, high blood pressure is one of them, diabetes mellitus is one of them, similarly insulin resistance is one of them, and then high cholesterol is also one of them. So having said that, it doesn't mean that for cholesterol, if you have high cholesterol, you'll only be doing cholesterol lowering medications and that would be fine. No, we do need lifestyle modification in the first place. We do need exercise, we do need physical activity, we do need great diet. And then after that, with them, we need cholesterol lowering medications. So in this video and maybe in the upcoming few more videos, we will be concentrating on what are the high cholesterol levels and what are the groups of the cholesterol lowering medications, what are their side effects and what are their benefits, and most importantly, why are they necessary? Okay, so the number one question is, how does cholesterol cause heart disease? How is it how is it related to heart disease or strokes? So what happens is, as you know, that heart is supplied by coronary arteries, and when cholesterol, I just want to keep it very simple, because in the previous videos I've delved very deep into the pathological processes, and that actually doesn't sit well too much, and it becomes very boring. So what happens is, when there is extra cholesterol in the blood, in these arteries, coronary arteries that are supplying the heart, or in the arteries supplying the brain, this extra cholesterol produces blockage. So as simple as that, produces blockage, and blockage means that the amount of blood supply going to the heart is reduced, and that causes heart attack. So it's as simple as that. So therefore, if cholesterol levels are high in the body, especially above 6, then it's recommended to use cholesterol medicines. Now, you may hear online some people saying that you don't need to worry about blood cholesterol levels as long as your other factors are fine. So for example, if you are keeping a healthy weight, and if you are insulin sensitive, you are not a diabetic, your blood pressure is optimal, but your blood cholesterol is only high, so you don't need to worry about that. That is not true, because according to the studies and according to the research, even if all the other factors are optimal, like your blood pressure is optimal, your weight is optimal, you are insulin sensitive and everything, but your cholesterol is high, there are still very much increased chances of getting heart attacks. So it means that cholesterol on its own is is as big as a risk factor as the blood pressure is, as obesity is, as diabetes mellitus is. Now again, increased cholesterol in the blood could be of 2 types. So one is familial hypercholesterolemia, which is related to the genes and the family factors. So I get to see so many patients in my practice who are so lean, actually their BMI is on the lower normal side, then their blood pressure is fine, everything else is okay, but they still have dangerously high cholesterol levels. And they say that we eat very good, like our food doesn't have high cholesterol, we exercise, we are very physically active, then how come the cholesterol is high? It is related to genes, it is related to the family history, unfortunately. And when their levels are also that high, like 6 and above, then we have to treat it with the medications. We will continue with all of that tomorrow.